So my name is Jeremy Freiberg and I work for Cobalt Connects. We're a Hamilton-based cultural planning organization that's worked with St. Joe's Healthcare for the last 6 or 8 months, doing a process that engaged both their staff and the public to understand sort of what's important about healthcare. What does compassionate care mean? What does innovation mean in current day in Hamilton with St. Joe's Healthcare? So we started with a process where we worked with staff to develop a really different way of engaging their staff. So instead of a paper survey, we created this glowing light box that sort of drove around all of their hospitals, 147 different wards, 1,300 staff, and asked them questions about compassionate care and about innovation, and to answer in their own words what those things meant to them. So we talked to them a lot about compassionate care, and the question about compassionate care was really important because they got to answer in their own words. So it wasn't a choose something from a list, it was what does compassionate care mean to you? And that could be if you're a nurse or a finance worker or an administrator or a cleaner, so use your own words. So they did. So they told us words and language about compassionate care, and we found there were sort of 5 general buckets, or 4 general buckets. One was a set of principles, so things like empathy, dignity, respect, working in a non-judgmental way that everyone across the organization said was really important. And then we kind of drove a little deeper, and there were things we called approaches. Listening, super important to everybody. And we found that nurses and physicians all said that the more they listen to their patients along their path through healthcare, the better they understand their story, the better equipped they are to give quality care. So listening, communicating, advocating, supporting their colleagues, that there's a real family feel here to how everyone works together. And then simple acts like saying hi and smiling to everybody involved. Anyone can do that, whether you're a cleaner or a technician or a doctor. And then there were a whole pile of occupation-specific ways of expressing compassion. So nurses felt like they were advocating. Doctors felt like they were providing specialized care. Administrators felt like they were helping people navigate the healthcare system. So again, in their own words, they created these 4 piles of approaches to compassion. So lots of people voted on those. And then we took that same set of principles and acts and approaches and presented those to the public. We went out to a whole pile of festivals over the course of the summer and asked the public to vote on which ones they resonated with best. So they did that by dropping ping pong balls and this weird thing over here. So then we go into the middle of the exhibit. So this is where we had the public voting on staff's compassionate care language. So you can see that each test tube is labeled with one of those sort of 6 principles we pulled out of staff. And the public was given a really short statement about each one, not knowing which one was a principle or a value or a simple act. And they were given 3 St. Joe's blue ping pong balls, and they voted, without the caps on, they voted on which ones resonated with them the most, which ones sort of impacted them. And at the end of the day, it was really interesting data in that the ones that were rated the highest, advocating and listening, are 2 principles chosen by staff, which the public didn't know. And then we see 3 others that are occupation-specific acts that are in sort of the 15 to 16%. So there's another tier of resonance with the public. And then the last one, innovation and research, being the lowest. Not that it's not important, but it's something that's sort of maybe a little external from the public, so they didn't resonate with them as much. So it's neat to see that the public stayed in line with staff by choosing principled answers as opposed to occupation-specific answers. So again, they're thinking about St. Joe's values way up top, which is really interesting for me. And then again, we asked staff and public about innovation. So there were 4 key areas of innovation that management had chosen already for St. Joe's. We wanted to know whether staff were connecting with those and whether the public were connecting with those. So 4 different areas: access to care for vulnerable people, use of technology to improve healthcare, community partnerships to improve healthcare, and the idea of holistic care with sort of mind, body, soul involved, not just physical. So we asked everyone to vote on sort of where they saw each of those as a priority for St. Joe's, both the public and staff. And it was amazing how close they were in feeling the same. So a lot of people choosing vulnerable population, and staff chose community partnerships as the highest rated one. And again, holistic care being one that was what we call volatile data. So places where some people rate it 0% or 5%, and some people say it's absolutely the most important. So it means that it's one of those things that's really personal. And that was true of both staff and the public, and that's reflected in the data. Where we saw a bit of a gap, so there's a bit of a gap in age in connection to technology. Some people, different age groups, feeling differently about the use of technology. And again, that idea that holistic care is something that's really personal, so the voting was kind of all over the map. And then the final piece is the audio station. So we took all those stories from the people at the festivals and turned it into this little audio station where we edited down the stories, made a little interface so you can just walk up, press play, and it'll play one of those. There you go. It'll play one of those 50 stories that we gathered. We gathered about 150 stories. We've edited it down to the 50 that were the best. And those can now all play, and you can walk up and hear any of them at any point in the exhibit.